All right, we are now recording the meeting. And I'll just introduce myself. I think I've met most of you. I'm Kathy Yoakum. I'm the ATP manager here at the Department of Mental Health and Addiction Services. And I know you all know each other. Have you all met Linda before? No? Oh, Linda, if you don't mind introducing yourself.
Absolutely. Thank you. Good morning. Linda Gallagher, Vice President at the Hamilton County Mental Health and Addiction Services Board.
Good morning. This is Najana Tenenfeld. I'm the project coordinator here at the Mental Health and Recovery Services Board.
Thank you all. I greatly appreciate you taking the time to meet with us this morning and facilitate this training. Alexis Deathridge, Specialized Docket Coordinator for the Hamilton County Drug Treatment and Recovery Court.
I'm Isaiah Lumpkins, the Director for the Hamilton County Drug Court Program. It's a pleasure to meet some of you for the first time. Good to see you again, Ms. Kathy and Ms. Linda.
My name is Abby Brody. I'm the Specialized Docket Assistant for Drug Court.
Well, welcome everyone. And I do have just a short PowerPoint. I assume everyone can still see that. So the addiction treatment program is in the governor's budget. So it is legislatively established. And of course, those budgets are reviewed the governor's office every 2 years. So in the budget, there is $5 million every fiscal year for ATP. And again, that's a statewide program. It is for certified drug and family dependency dockets, which also can include an individual who is under a community control sanction with the ATP participating judge. So not any judge who has someone on a community control sanction, it's those ATP participating judges who, if they have someone on a community control sanction who is not participating in their drug docket, then you could use ATP funds. However, the same other eligibility and other requirements still apply to those individuals. Starting this fiscal year in July, fiscal year 23, we have about 146 specialized dockets. When I started about 3.5 years ago, we had under 100. So the program has grown. And of course, it is one of the governor's initiatives since he has started office is to expand specialized dockets in the state of Ohio. So I know, there's have been a lot that have been added. Now, ATP is, not every single docket in the state of Ohio that's eligible is necessarily participating. So that number, could grow. And then treatment providers do need to have our certification and provide access to substance use disorder treatment and time-limited recovery supports. And these recovery supports help eliminate barriers to treatment. They are specific to an individual's needs and can include things like, and I'll get into more details later, but housing, transportation, childcare, job training, obtaining a driver's license or state ID card. There are 62 participating counties. And some of this information, like this slide, for example, is on our website. So to be eligible for ATP, so there's specialized docket eligibility. Obviously, they have to have at least initial certification, be a drug docket, which now includes, and this is expanded from the Supreme Court last couple years to include, because we used to only do drug dockets and family dependency dockets, but now the drug docket has expanded. And now the domestic violence, human trafficking, the veterans, OVI dockets now all follow the drug court model. So we can now consider those dockets drug dockets. So this specialized docket also, which by definition of the docket, treat individuals with substance use disorder and offer medication assisted treatment. Obviously, the docket is offering it, but they're allowing and offering, through one of the certified providers for medication assisted treatment. And of course, we also need to utilize the providers who are OMAS certified. And then, so the ATP funds, they're an allocation to the board. So the board is the manager of the funds. And of course, they follow our allocation guidelines and agreements and assurances. And so they can determine who they contract with to provide these treatment and recovery support services for ATP. So just because someone's OMAS certified doesn't necessarily mean that they can participate in ATP, because it's up to the board who has the allocation, who manages the funds. It's up to the board to contract with those providers. And if anyone has any questions throughout, please feel free to interrupt and ask as we go along. I don't mind that at all. Client eligibility, obviously the client would meet the legal and clinical eligibility criteria of your docket. Obviously they have a substance use disorder. Now in the drug dockets, pretty much everyone would have a substance use disorder, but in these other dockets that we've added, like the veterans, domestic violence, they have to have an SUD, a substance use disorder, to receive ATP funds. So, where in the past, everyone in the drug docket would be eligible. And some of these dockets, if they don't have a substance use disorder, then they would not be able to utilize ATP funds. Now, a lot of these rules that I'm describing is in the legislative language. So it's not like something I've made up. It's actually in law. So we do have to be careful making sure we follow these rules, because it's law. So the drug participant must be complying with the docket and their program requirements. They must be considered an active participant. So if they're part of the drug docket and they've been discharged from your docket, and maybe you have some sort of aftercare program, I've heard that term used before, they're no longer eligible. Okay, so they have to be active participants of your docket, or that other category, on a community control sanction with the ATP participating judge. Okay, so if you feel like they're not complying with your docket and you want to discharge them, then again, and bring them back, while they're discharged, they're not able to access those funds unless they're on a community control sanction. So that's okay. So medication therapies. This is really more for treatment providers, but I will go over it for you just so you're aware, because it's the SUD treatment provider that's obviously going to be providing these medication therapies. So ATP will fund MAT. Remember, the person's insurance is always the first payer, whether it's private insurance, Medicaid, Medicare. You always bill the insurance first. Obviously, this is for providers, but so the insurance is to be billed first, and whatever the insurance will not pay, then ATP can fund those medications. And again, these are medications in regards to their substance use disorder, okay, or co-occurring mental health diagnosis medications for those, because you can treat the substance use disorder and the co-occurring mental health disorders, okay. So medications, obviously, to treat opioid use disorder or alcohol use disorder, which is what we typically think of when your Suboxone, Vivitrol, et cetera, when we think of MAT. But we also recognize withdrawal management medications. Okay, so ATP can also fund withdrawal management medications. Okay, so and we want to make sure that there's no need for a prior authorization. Again, this is more for treatment providers, but some medications, I think it's Sublocade is the only one left now, I think, that requires a prior authorization. But if you let the managed care company know, so the individual's managed care, you know, whether it be Buckeye, CareSource, or Medicaid, that they're participating in the addiction treatment program, then there is no need for a prior authorization for MAT and withdrawal management medications. Okay, so the withdrawal management medications is kind of a newer, they put that in the last budget bill, the legislative language, that withdrawal management medications are covered under ATP. Okay, so as I said, treatment. Now, the majority, I would say, of, it's been my experience, the majority of ATP clients do have Medicaid, and Medicaid does pay for the majority of treatment, both outpatient, residential, et cetera. These are some examples on the list of treatment that ATP may fund. It's not necessarily on an all-inclusive list, but again, these are treatment for the substance use disorder or co-occurring behavioral health disorder or mental health disorder. Okay. As far as, let me just speak to your analysis real quick. So for your analysis to be considered treatment, then it does have to be for treatment purposes, not for compliance of the drug docket. Okay, so that means that the substance use disorder or the provider, the provider who's providing these the treatment would be ordering the urinalysis. And there's rules around that, you know, medical person has to order the urinalysis for treatment purposes. Okay. Now, of course, if there's release of information, they of course can share those with your docket if the client, you know, signs off on that release of information, which I'm hoping, you know, you would do with all your clients who are seeing a treatment provider. Ask that the client complete a consent form so that, you know, you can communicate. So if the, you know, the docket already has a protocol in place for random drug screens. And so, however, you know, you've already set up your docket to do that. You could use your court admin funds to pay for your analysis, but we're not wanting to use the pot of treatment and recovery support funds for your analysis only for compliance basis. It would be for treatment purposes. And of course, again, they can share those with you. Any questions about that? Okay. So because the majority of clients do have Medicaid or private insurance that pays them for the majority of treatment, a lot of the ATP funds are used for recovery supports. Okay, so and I believe everyone has the guidance document that probably was sent around a few weeks ago. That lists, there's like a second page, the recovery supports, that kind of gives a narrative of some acceptable recovery supports and some unallowable costs, if you will. It's not really a black and white issue. It's a little more gray when it comes to recovery supports, because they are to be individualized to the ATP client's needs. Okay, so ATP recovery supports are time limited, individualized, and for the identified clients. A lot of times I'll get questions about, well, can we purchase clothes for the client's children? Or, you know, something for the school supplies for the children. Unfortunately, no, it is for the identified client. Now, if for example, food. Obviously, the food's going to benefit the whole family, and that's fine. But it's, really for the identified client. Okay, so some examples are, housing. Now, when we say time limited, so if a client, and let me just preface this by saying it's up to the board to manage the funds, and the board can put limits or parameters on the funding. And Linda, I might have you just speak to this briefly, if you'd like. Is some boards will say, we'll pay for the deposit and 2 months rent. Okay, so some boards will limit to a specific number of months of rent, or even a cap of an amount per month. And, it's going to vary per board area and, cost of living in your exact area. And it's time limited because, we don't want to set up a client in an apartment who can't continue to pay for that apartment. ATP funds are not unlimited. You have a set allocation, and Linda wants to make sure that's lasts the whole fiscal year, right? So, Linda, do you have any? I know some counties use checklists, or do you have any limits or parameters, or do you do it kind of on a case by case basis?
We will have some parameters, and we'll be working with a provider because of course, it's going to be the provider who will be receiving the ATP funds to provide these recovery supports. So we work with the provider. We don't have a hard and fast, it's, black and white, it can only be this. And Snejana will probably be your go-to person. Isaiah and Abby and Alexis, whoever is going to be the point person at the court, and certainly with the provider too, or providers. To work with them and establish, these are the guidelines of what we're looking for. But again, just to reiterate what you said, Kathy, what we're trying to do is, that initial kind of support. We're not, obviously these funds aren't for paying for somebody, to live in an apartment for the next 6 months. It's, to get them to decrease those barriers so that they have that opportunity to participate in treatment. And if they're homeless or experiencing, a barrier to housing, then we want to kind of get over that first hurdle, and at the same time support them so that they can support themselves, pay the rent, as well as get to treatment.
Great, good, well said. So the treatment and recovery supports, they are, again, reimbursed through the OMOS certified provider agencies that the board is contracting with. Okay, so just keep that in mind. So it does have to, you might find a great recovery support, but again, it has to flow through that certified provider. Now, I've had, there's been, I think Franklin County did this once. There was this great, it was a financial class, well-being class, or I think the organization was called Onionomics. And like onion, you peel back the layers, something like that. So they, through the provider agency, contracted with this other organization to provide these financial well-being class to some of their participants. So just keep that in mind, but it of course would be up to the provider agency of whether they want to, provide some of those additional services if the need is there, or you have the resources in your county. And so when I say individualized needs, who's determining what those needs are? It's the provider and the docket. So not just the docket, because it's a combined effort. It's a treatment team. It's the docket plus the provider working together to identify the treatment and recovery support needs of the client. And so there should be regular communication, if not attendance, at treatment team meetings. Providers can always attend weekly treatment team meetings. Some counties they do, but I know that's not always possible. But if it's not possible, then they should be communicating, whether it be via, some sort of internet capacity or email or phone call on a regular basis, so that you both are on the same page with those clients and what their needs are, making sure their needs are met. So employment, and again, this is not an all exhaustive list. Of course, we have some things that are unallowable. And I'll get to that on the next slide, but these are just some areas that are definitely allowable. Transportation, bus passes, gas cards, if you have any type of, Uber or Lyft, and any type of life skills, parenting classes, peer support activities. Now, if you utilize certified peer supporters, which is an excellent resource, many counties, dockets, find certified peer recovery supporters very helpful for their clients, very successful. Of course, the certification is through our department. So they are certified peer recovery supporters. And again, that's what ATP could cover, is certified. I know I said it like 3 times, but it's for emphasis, peer supporters. Okay. So want to make sure they have that certification. Again, if they have Medicaid, then if they meet the requirements through that provider agency, some certified peer supporters actually can get reimbursed through the provider agency for their services. But if for whatever reason they cannot, then ATP can cover some of those costs. So if they would happen to go on an outing or an activity, as long as the certified peer supporter is present and it's, considered a recovery support, then ATP could pay for some of those activities. Okay, so not just pro-social activities, it's an actual planned activity with the certified peer supporter. Okay. Childcare, we could also use ATP recovery support funds for childcare, not ongoing childcare, but again, think time limited, to attend treatment, to attend court, to attend a job interview, but not for like an ongoing employment. Okay, again, time limited. Any type of forms of ID, maybe they, lost their birth certificate, needed to get another copy, help to pay for their driver's license, social security card, emergency basic need items, food, clothing, again, emergency. So we're not buying them an entire wardrobe, but maybe they just came out of homelessness, they need some things, you can use ATP funds to pay for that. So I get questions, and Linda probably does too, on a regular basis as far as, could ATP fund this? Because we do leave it gray for a purpose, because it's to, meet an individual's needs. But at the same time, these are state dollars in law, and we of course want to make sure that we're following the rules and policies and procedures. So if you want to run anything by Linda or myself, I get weekly emails, say, hey, this is maybe something a little different we haven't thought of. Could ATP pay for this? So please feel free to utilize us. Unallowable costs for recovery supports. And again, this is not an all exhaustive list, but kind of some frequent requests, which ATP cannot pay for an individual's fines or court costs. Those fines and court costs are assessed to the client, because of, something illegal they did, and it's their responsibility. So we do not, we cannot use ATP to pay for any type of fines or court costs, attorney fees, those kinds of things. Okay. No tracking devices, ankle monitors, breathalyzers, those kinds of things. No medical or dental, definitely no dental. Okay. And again, I know people try to make cases for, because of my, substance use disorder, my teeth are bad, but you have to draw lines. It's not unlimited funding, and dental is not considered, part of an individual's treatment for SUD. Okay, so no dental. Hopefully they have insurance that will cover, and medical only if it's related to their substance use disorder or mental health disorder. For example, if they have to have a blood draw and they don't have insurance, but it's for the purpose of the SUD or the maybe mental health medication, then that could be allowable. But for the most part, no medical services. Okay. No furniture, no appliances, no car repairs, no tires, and no auto insurance. Okay. Again, got to draw lines. And it's, when you're talking about state or federal funds and purchasing certain properties, I mean, technically, those properties really do become property of the state. So, if you think of it in that manner, that kind of helps. So we're not purchasing like furniture, cars, those kinds of things. Those are unallowable. Any questions about that? And you'll have questions as down the road, which is fine. But anything that you can think of right now? Any needs of your clients that you kind of question whether it'd be an allowable cost?
Ms. Linda, are you able to just provide some information on some requests that you've gotten consistently that have been turned down?
Working with the provider, this is pretty clear cut. What will pay and what won't pay. But I'll have to go back, Isaiah. Obviously we have not had any ATP requests for a year.
Right.
And so I don't remember. So I'm going to have to check on that, honestly, Isaiah.
Okay.
I don't think the list is long. I mean, I think that what Kathy was describing was, some of the questions about car repairs, I think has been not a frequent, but the provider asks it once, we say no. And so the provider doesn't ask again. So
Right.
So
A follow-up question: how long generally does it take from the time the request from the provider submitted to the funds being released?
Well, what we'll have with the providers is they'll have an allocation. So that is really one of the defining factors of even a provider taking a look. The provider has to kind of budget. If somebody has $100,000 for of ATP funds, it's at the end, they have until they spend it, and we don't have additional ATP funds. So they kind of have to prioritize based on the number of clients that they're seeing. And, not necessarily every single client is going to be able to have every single need met by the ATP funds. So, the provider is going to have to kind of take this as a learning, how many clients are coming through here, what are their needs. Maybe, we focus on transportation and some recovery supports and, and how, some emergency basic kinds of things. And then, so it's a pretty gray. So it's kind of a, until the provider has a sense of who the clients are, what their needs are, how much it's going to cost. Where it's kind of a dialogue really with the court, the board, and the provider. But certainly it is that provider who's paying attention to those details and helping us, giving us the information of what the client needs are. Does that make sense?
Yes, ma'am. Thank you.
All right. Oops. All right. Okay, so this is the last slide. So, and I probably already said all this, but it is state funding. It is from each fiscal year. So we know how much we have this fiscal year. I don't know how much I'm going to have as of July 1st of 2023. Hopefully the same amount. But until the governor signs the budget bill, unfortunately, and usually it's on midnight of that very last day that the budget bill is signed. So I know a lot of people want to email me in June, and unfortunately I always have to give the answer until that budget bill is signed, even though I think I might what I might have, never know until it is signed by the governor. So in the past, we have allowed some carryover funds of that allocation. Now, I do expect you to use all of your court admin funds. Those really shouldn't be carried over. Those should be spent within your fiscal year. But we do allow county boards to carry over funds that we have in the past. Again, no promises. For future, I can never promise that. It's not my decision. It's up to, fiscal higher ups, et cetera, the director, Director Chris, Lori Chris is our director. So she works technically for the governor. And so those decisions are made usually in the spring. In the past, we have allowed ATP carryover, but really the ATP funds are to be primarily used within the fiscal year they were awarded, or if you had carryover funds, which in Hamilton's case, obviously, all these funds were carryover funds because of the prior Common Pleas Court losing the certification. So a little bit different situation, but the hope is that you'll use the majority of your funds this fiscal year. We do require quarterly reporting from the board. So the board will be asking your docket, the number of participants. And of course, I also ask for the amount of funds that are used for treatment and the amount of funds that are used for recovery supports each quarter. So that's coming from, the treatment providers, obviously, who's providing the treatment and recovery supports. But what Linda will be asking your docket is how many clients you served. And when I say served, how many is in your docket? How many qualify for ATP, which I believe in your case, well, your docket's a little bit different. If you were just your average docket in the state of Ohio, that's a drug docket, all your participants would qualify. Because your docket's a little bit different and you have, you're getting all the drug cases in your county and they're not all going to be in that high risk, high need category, which is technically the specialized docket. But so your case is a little bit different. So we might need to have further discussions about how we count your participants. Alexis, have you given any thought of that? Because what we need is the number of clients who are participating in the specialized docket. So those would be primarily your high risk, high need And don't you kind of have like a 4-tiered approach or 4 levels, Alexis?
Yes, yes, ma'am, in terms of the phases and the tracks of those that are high risk, high need. We certainly, once we officially roll that out in terms of delegating the days and the times based off of the track that they're in, we'll be able to much better track that, especially with the system that we just integrated for all of our data collection purposes. We will be able to badge them and be able to provide that number regularly.
So when we talk about individuals who would be eligible for ATP funds, so we determined the court admin funds based upon kind of your top tiers. Obviously, individuals who have a substance use disorder who are receiving, treatment. So we based kind of on those top 2 tiers to kind of be fair this first fiscal year until we kind of figure out where the numbers will be. So do you believe you'll kind of count those top 2 tiers or just the top tier? Like when you're reporting to the Supreme Court for those, higher risk, higher need?
It's my understanding, Ms. Kathy, and correct me if I'm wrong, that the administrative allocation was based off of approximately 400 participants that you and the Supreme Court of Ohio decided that approximately 400 of the individuals that we serve are high risk, high need. Is that correct?
That is correct. Well, half correct. Because so originally I had asked how many you would serve and you said about 800. Okay. But those 800 are the total, and again, your county is different than every other county, and I know you know that, is typically, obviously, specialized dockets are supposed to be high risk, high need. Are every specialized docket only serving high risk, high need? Probably not. Some might be high need, maybe moderate risk, or so to be fair, this first year we did the top 2. So we're not, I wouldn't expect you're going to serve 400 high risk, high need individuals. That would just, but we kind of gave you credit for those top 2 tiers. Does that make sense?
Certainly. I would say that it'd be appropriate to count the top 2 tiers, especially as the Supreme Court of Ohio comes and does additional trainings with the rest of the judges here at the courthouse to talk about how this specialized court statistically and scientifically shows has the greatest outcome when serving high risk, high need individuals, and the importance of ensuring that those individuals get rolled here. And so I certainly think that as the Supreme Court of Ohio, and we would wish to see that we are serving, of course, those high risk, high needs. And seeing that greatest impact and outcome. So I think that it's appropriate, Ms. Kathy, to count the top 2 tiers.
Okay. Okay, great.
I have a
So,
question, Ms. Kathy.
yeah.
If that determination changes, what kind of notification will we receive if we reach a point where you no longer look at the top 2 tiers, but the top tier? What kind of notice would we get so that we could plan for that change? Or is that something that would remain?
So that's not really my decision. It's kind of in conjunction with the Supreme Court and your docket. I want to be fair and equitable though, across the state. And, with the court admin funds, in the future. So you know, in meeting with the Supreme Court, I think they're kind of still trying to figure out, or we're still trying to figure out kind of those reporting guidelines for your docket and how, you know, some of those things are going to work. So it's not like, Isaiah, I'm never going to say like it's my decision. So it's really kind of between you and the Supreme Court of who you're kind of considered in that specialized docket piece of your court. Does that make sense?
Understood. Yes, ma'am.
Okay. And you guys are the experts, you know, not me, on specialized dockets. So that quarterly reporting is going to be coming from the board. So Linda will just be getting those participants from you. And whatever that looks like on the report is fine with me. The court and provider administrative funds. So your docket administrative funds, those are to be used at your discretion to help support the program. So I know Linda has a plan at the board to get those funds to you. But if you'll try to spend those by June 30th, and those are the most flexible, if you will, funds. Those are not just for the treatment and recovery supports of clients. That's the majority of the money, but your court admin funds, those are funds to be used at your discretion to help support the program. So you could use it for personnel, mileage, training, anything to help support the program. Obviously, you have your own auditors to answer to, so you know, it's not a free for all, but obviously you're going to follow the rules and guidelines of your fiscal whatever. So any questions about that?
Kathy, I have
Okay.
a quick question
Sure.
about that. We don't have a report to the state for the admin funds, do we?
Correct. There is no reporting. So once
Okay.
those court admin funds are passed on to the docket, they're off your books. So obviously, you know, then the docket then has the fiscal responsibility of spending those funds appropriately.
Perfect. Thanks.
We can add dockets throughout the fiscal year. I do save back a little bit of the funds at the beginning of the fiscal year. I do have to distribute them by early spring, but I do save back some funds if there's other dockets who are interested in joining us throughout the fiscal year. So we can add those. It's not like a competitive process, if you will. Anyone who wants to participate can participate. We have obviously a process to do that, application, etc. And they have to have at least initial certification and be considered a drug docket or family dependency docket. Okay. Again, you can contact myself. Linda, again, Linda's the manager of the ATP funds. So if you would email me directly, and I respond, I will copy her because she's the manager of the funds, or I may defer to her. So I guess that's it. So that's really kind of it in a nutshell. And if you have questions along the way, please don't hesitate to contact us. Again, we can have another training down the road for any new provider.
And I would really like to advocate that we do that. The providers that the court wants us to contract with have never had ATP funds before. So I think this would be a great learning for them.
Sure. So whenever you're ready, let me know. give me some available dates and times, and I'd be happy to coordinate the training. Again, it only lasts about an hour, so that's not a problem at all.
Thanks,
Any other-
Kathy. I found this very helpful.
Good. Alexis, do you have anything else?
Nothing further from me. Just wanted to again thank you guys for your time and for your guys' continued support. And of course, we are very thankful for how this funding stream will best support not only this specialized docket, but more importantly, the participants. We always tell them that their success is our success, and we certainly mean that. And we're thankful to be able to serve them in such a capacity. So thank you guys so much for your time. And I agree. I think that it goes without saying as well, Ms. Gallagher, to have additional training that takes place with the providers when the timing is appropriate. But otherwise, nothing further from me. And I hope that you guys have a great weekend.
Thank you.
Yes, thank you. You too.
Thank you.
All right.
And Miss Kathy, if you'd be so kind to share the recording once it's finalized.